Titanium dental implants are small little screws made of titanium that we use to either replace teeth, or we use them as part of a bridge to replace several teeth, or sometimes you can use them also to secure a denture. So you could clip a denture on and clip a denture off of implants. And they're inserted into the jawbone under local anesthetic, and then your jawbone will bond with those dental implants over a period of time, generally 3 months, and become almost part of your jaw and something that you can function and eat with. Dental implants come in many different types, but the ones that we use are ones that we're familiar with, that we've tested over many years, and ones that we're happy to put into our patients. The benefits of titanium for use as an implant material is that it's been around for many, many years. It's reliable, we know that it works, it's biocompatible, so it doesn't react with your body. You don't get rusting around it as you would do in any other metals, and your body, the cells of your bone will attach to the surface of the implant itself. Titanium is also really strong, and we don't tend to get fractures with it, and it works really well under the forces that it's put on when you're biting and chewing things. Titanium is the same kind of thing as you would use if you had like a prosthetic hip or a knee, or if you broke your arm and you needed a plate placed in your arm with some screws. It's all titanium. Once an implant is put in, it's usually left there for 3 months for the body to bond to it, or as we say, osseointegrate. That's where your bone bonds directly to the surface of the implant, to the titanium. So once that osseointegration has happened, we're happy to take an impression of the implant and provide you with a crown or a bridge or even a denture on top of those implants to give you back your bite and your smile. In terms of side effects of dental implant placement, whenever you do any kind of surgical procedure, you would know to expect some discomfort, perhaps some swelling or even some bruising after certain dental implant procedures. It depends on how small or major the procedure is. If an implant is poorly placed, if it's put in the wrong position, or if it's put into a situation with insufficient bone or insufficient gum, or gum that's too thin, then no matter how good the implant is or how good the brand is, the implant just won't work over the long run because it doesn't have the foundations to keep it solid. Whenever people travel to places like Turkey to have a dental implant placed, they are often under a particular treatment plan which condenses the time scale required to put implants in successfully. And what I mean by that is when we place dental implants here at 3Dental, we normally give them 3 months to bond or heal before we go putting a crown or bridge on top. And in that 3-month period, if there's any issues at all, we want to see you straight away so we can resolve them. If you are a long distance away from your provider, and if you have a problem, it's very difficult to resolve that problem effectively, and you'll often find that it can spiral to something much worse, compromising the long-term results of your treatment. The length of time which titanium dental implants last depends almost entirely on how you look after them. So if you keep your mouth clean, if you attend a hygienist regularly for dental cleanings, and if you attend a dentist for examination to look at your implants and make sure that they're okay, then they can last for a very long time. About 80% of dental implants will last for 15 years and longer than that. In order to make this treatment as accessible to as many people as possible, we offer free consultations, payment plans, and we offer very affordable prices for our dental implants.